for our loved ones and our communities. There's no easy answers here at all. We're being challenged. We're being asked to make sacrifices in our way of life. God willing, we should continue to be patient and treat each other with respect and love, knowing that better days will come. As your governor, I've listened to the voices in the room. I've consulted with medical professionals, with public health leaders, with workers, with business people, with local officials from all over the state. And I strongly believe that this is the best path forward for all of us. But before getting into these details, I want to address what might very well be the first question on many people's minds about today's shift, and that's why now? I want to show you a number of charts that will help illustrate why the state is moving the way that we're moving, the progress we've made, as well as the danger ahead for all of us. It's a time not for anxiety, not for fear, but for justified caution in all of our actions. This shows how we're seeing a significant drop in new cases. It measures the 3-day average to compensate for outliers. We plateaued around 300 new cases per day for a few weeks in mid-March and mid-April, and now we're significantly lower than that peak. This is another way to visualize it. This is something we've been looking at over time. It's how quickly the rate of cases is going up. When we started out, cases were doubling every day and a half. That's why the stay-at-home was absolutely critical to stop that exponential growth curve that would have led to mass casualties that overwhelmed our hospital system in our state and led to unnecessary death. People whose lives could have been saved by oxygen or a ventilator, but wouldn't have had a bed to do that in. As you can see, the daily growth rate has stayed under 10% for April. Now it's even below 5%. As of Saturday, 3.8%. That really shows the results of the actions that you've taken by successfully staying at home to help reduce the spread. And we've seen the same thing when it comes to hospitalizations. Remember, the case growth is always imperfect. It doesn't catch all the cases that we have. Hospitalization, while it's lagging, it could very well be 5 to 10 days after a case starts. People don't often require hospitalization until the disease has progressed. This is for the 1 in 10 or so people that need hospitalization. It's a lagging indicator, but it also is a more concrete indicator of where we are. And the daily hospitalization rate's been declining for a number of weeks. So we have fewer hospitalizations now than we did a week ago, than we did 2 weeks ago. In fact, the rate Saturday was 0.3%. So given that those hospitalization rates and the new cases are declining, and given where we are in terms of building the additional hospital capacity, the staff, our modeling shows that we can handle the caseload and that we need to figure out how to do this in a sustainable way for many weeks and months. In short, we've met the criteria for success that we laid out over a month ago when we put the stay-at-home order in place. We've slowed the spread of the virus, and as you know, there's a formula that scientists use called the R-naught, which is how many people are infected by each person with the virus. It was over 3 originally, according to the epidemiology work in our state. It's now close to 1. Thanks to the stay-at-home order, we no longer have the alarming exponential thread that we had a month ago. We've bought time to build our healthcare capacity. We've revised our number downward from about 2,000 extra beds to 800, 600 at Denver Convention Center, 200 at the Ranch in Loveland. And we've successfully recruited healthcare workforce, hundreds of new workers licensed by our state licensing agency, DORA. In addition, hundreds of volunteers have signed up at helpcoloradonow.org. And we've also had time to buy masks, gloves, ventilators, and other equipment. And in fact, I want to highlight the mask I'm wearing today. Was made by skilled refugees in Denver, and I want to say thank you to Naughty Tie for these Colorado branded masks, and also a thank you to coloradomaskproject.com and everyone who's doing their part in wearing a face covering. If you need to see the patterns or want to help, coloradomaskproject.com is the place to do that. We have already distributed in Colorado 469,095 in K95 masks, 660,000 surgical masks, over 100,000 face shields, over 100,000 gowns, just over 1 million gloves, and 2,500 coveralls. In addition, we've ordered, and we have additional 100 ventilators from where we started, and we have ordered an additional 1,000 through FEMA if they're needed. That supply has largely been nationalized as the peaks in different areas move on. New York is shipping them out. Other places will need them. We are very confident with regard to the ventilator supply. And we've successfully bought time to obtain supplies, to grow testing capacity, and we're going to provide a very detailed update on testing and where we're at. Very exciting plans and news on Wednesday of this week. We need a whole presentation for that, and a lot of Coloradans want to know about that, and it's an important part of our 4-tier strategy to contain the disease, right? Over the next month and months, protecting our most vulnerable, continue to expand testing and tracing, wearing masks, so important. That's the piece that we all need to do. Those of you who are watching this, we all need to wear masks when we're out in public. And then continuing sustainable social distancing, meaning less social interactions, standing further apart in stores, all of those details that we're going in as a lot of these stores and companies reopen. And we've been very consistent and transparent about what our goals were. So I just want to show you some slides that we showed you back on March 27th when the stay-at-home was starting, just so you can see what the bar was then, how we've met that bar, how we're moving forward. Stay-at-home is the most severe, unpleasant step for all of us. It's unpleasant for governors, it's unpleasant for the economy, for individuals who can't earn a living. Very, very, very difficult. So we said, here's why we're doing it. We had to describe this and justify this to the people of Colorado. Here's why we need to stay at home for a month. Because we need to preserve our healthcare capacity so we don't breach the healthcare system. We need more equipment and testing. And then we need to get out of this phase as quickly as possible. So we have knocked down from the over 3.0 to around 1 the contagion or R0 value. And we preserve the healthcare capacity. We have more equipment, plan to continue to scale up testing. And then, as we said, March 27th, quickest possible. Return to work, productivity, and social and economic normalcy, right? We use the word normalcy because it's not the way it was in January or February. It's just more normalcy, more ability to enjoy life. This is more sustainable from a mental and physical health perspective, from an economic perspective, while meeting the healthcare needs of the state and the public health need. That's how we define success March 27th when we instituted the order. And that's still how we define success today. And many people sort of, and I completely understand this, people wanted to think that there was even more light at the end of this difficult stay-at-home period than there was. Many people thought that this would be the end and we could go back to normal, despite what me and public health officials have said it really every time we've had the opportunity that we need to continue social distancing after the stay-at-home order ends. The goal was never to eradicate the virus in the United States. Simply not possible. Over 1 million cases. There's some small island nations that have successfully done that. We applaud New Zealand for likely achieving that goal. Anybody who enters New Zealand has to have a 14-day quarantine before they're allowed out. Taiwan. Colorado borders a number of other states. There's over 1 million cases in the country. We don't control who enters our airspace, regulated by the FAA, or who drives across our state borders. There was never a goal in the United States to eradicate the virus. It's unrealistic. Maybe small island nations can do it, but no state in the United States has set that as their goal. Extending a statewide stay-at-home order only continues the same level. It doesn't have any impact on what that peak is. It simply changes the timing of the peak. The evidence that we've seen shows that extending the stay-at-home order would not reduce the severity without the continued ongoing interventions to flatten the curve. What's more important than the exact day that the stay-at-home ends is what people's behavior is over May, over June, over July, which is why we're laser focused on providing a safer, sustainable environment where people can earn a living and still be reasonably safe in the presence of the deadly virus. As a state, we've achieved what we wanted to achieve with a statewide order, and really that's thanks to the great job that you've done staying at home. And I know how difficult that can be. Humans are social animals, and it's been very difficult to have done this for the last 32 days. We flattened the curve. We bought ourselves the time that we needed to expand healthcare capacity and to create a sustainable way to manage living with the virus. And that's why I'm excited that we're moving to a new phase, safer at home. I want to lay out the goals of safer at home guidance, right? So we'll show these slides probably in a month or month and a half, and you can say, did you meet these? And take us back to whether we met these goals, because here's what we're trying to do. We're trying to manage the spread, around 1, may go up a little, may go down a little. but we will have more interactions in May than in April, but we feel that in the modeling, Coloradans can have more interactions and still handle a rate of spread that, stays close to, 1.8, 1.5 in that range, not that exponential 3+ curve that we saw. Of course, access to world-class health care for every Coloradan that gets sick, and that means both Coloradans with COVID-19 and Coloradans that need our healthcare system because they have a heart attack or stroke or appendicitis. We need to have both. We can't compromise on making sure that every Coloradan that gets ill has access to the health care they need to get better. Find a more sustainable way to live, right? Mentally, physically, economically. We all know that we need a sustainable way to get through this. It's amazing. The job you did was amazing, being able to put up with and comply with that stay-at-home piece for so long. Thank you. Your success is the only reason that we are where we are today, with the ability to enter a more sustainable phase where it's not going to be life as normal. We're in this for the long haul, but it's sustainable for the medium term. And it's likely that we'll be here for some time, and we hope that with Coloradans fully complying with and participating in this new way of living, we'll get the fulfillment we need, economic, social, mental, physical, and at the same time, we'll be able to meet the public health criteria for reducing further restrictions over time. We need to, through this stage, help Coloradans have the opportunity to earn a living while protecting health and safety. Most Coloradans need to earn a living to make ends meet, and we get that. They'll have the opportunity to do that. Why continue to leave businesses shuttered and employees without a job if we don't even get anything for extending the stay-at-home order? If the viral levels continue, which they have been under this stay-at-home. Remember, under our stay-at-home, we had many critical industries that continue to function. Every state in the country did a stay-at-home in that manner. That's very different than the stay-at-home orders like Wuhan used, which were constructed to eliminate the virus from that territory. Those were enforced curfews, literally couldn't leave your home. Nobody was working except for the people in law enforcement enforcing it. A lockdown-style approach that no state in our country has used and really isn't even within the legal tools of governors or presidents, nor is it consistent with the freedom and individual choice that we enjoy as Americans. So that was never the goal. The goal was to reduce the spread and the exponential curve and make sure we had the medical capacity to give everybody who contracted COVID or other diseases a fighting chance to survive, to get through. 9 out of 10 people who get COVID won't need hospitalization. Of the 1 in 10 who do, most will leave the hospital on their own 2 feet, and some won't, but it won't be for lack of providing them the very best treatment, oxygen, and in the extreme cases, ventilators that they need. We also need to minimize the secondary health impacts of staying at home. And I want to stress that even during these times, if you need non-COVID medical care, if you have chest pain, dizziness, seek out that medical care. If you would have gone to the hospital in January or February, don't let the fear of COVID prevent you from seeking out the medical treatment that you may need today or the testing, because we don't want to see more people die of non-COVID causes just because they're fearful of COVID. A very important message from our healthcare professionals, our hospitals, and it's very important that we do that and live our lives in a way that we're addressing the non-COVID healthcare needs which continue to exist. And finally, protecting our vulnerable populations. While 1 in 10 need hospitalization overall, that number is much higher for people in their 70s and in their 80s. It can be 1 in 3, 1 in 4 need hospitalization. Survival rates are much lower, and we need to continue during this period of May to protect our most senior residents and those with pre-existing conditions, even more so than we did in April. And I'll talk a little bit about some of our work around that, including testing workers at nursing homes and senior facilities, the workers without symptoms. We've done that at 3 facilities. We're doing it at more, starting with the largest nursing homes in our state. First, I want to take a moment to thank and congratulate you, the people of this state. The numbers tell us you have been taking stay-at-home seriously. I know it hasn't been easy. I'm also here to say that it won't be easy going forward. This is not any kind of mission accomplished moment. It just means we've avoided a catastrophe. We've avoided a breach of our healthcare system. We've avoided mass loss because we didn't have enough medical capacity. But we're far from back to normal. In fact, we need to continue, even more so, to be vigilant, to wear masks when we are outside and in public so that we can move safely through this next phase. Our hope, my hope, your hope, is to be able to continue to relax more restrictions in the future. We all hope that restaurants can open this month, that we can have more and more ability to be able to do the things that make Colorado special. But that'll only happen if we succeed in maintaining the social distancing and wearing masks when we're out. We need to continue to be extremely vigilant in preventing the spread of this deadly virus. That's what this new phase is all about. I'm confident that Coloradans will continue to be vigilant in May, just as we were in April. Because of your commitment to stay home except when absolutely necessary, to practice proper safety protocols, we can move to this new phase, and our hope is to continue to be able to give more opportunities for the people of Colorado. At the same time, we know that this social distancing, the safer practices you've seen in your grocery stores will be similar to the measures that other stores that reopen May 1st will also observe to prevent future outbreaks. But if we slack off, if Coloradans let up, if less people are wearing masks when they're in public, if stores aren't being careful and personal services aren't being careful about following the guidelines that we put out today, then it's likely that additional restrictions might have to come back. Our gains will be lost. This great sacrifice that Coloradans have made will have been for nothing if we can't continue and maintain the social distancing needed throughout the month of May. We're going to be watching the data every single day. And if the numbers begin to climb at an unsustainable rate, then we're likely to have to go backwards rather than forwards. It's really up to the individual choices, the informed decisions that the people of Colorado make to wear masks when you're out, to only go out when you need to, and have safe social distancing practices in not going to parties, not going to large congregations of people more than 10, and just using some common sense. That life you save, it could be an elderly neighbor, could be an aunt or uncle, and it could be your own. It could be your own. And that's why it's so important to make sure that we act carefully, with caution, not with fear, not with anxiety, but with caution during the month of May. We're nowhere near to being back to normal. It's going to be a long time before things look like they did in January or February. We all look forward to that day. But things are going to be more sustainable, and Coloradans can earn a living and have more fulfillment during this month of May because of the good work of Coloradans during the month of April. This is a marathon, not a sprint. And you know, we finished the sprint phase, and sometimes things are easier when they're black or white. You have to stay home, you can't go out, or you can go out. Well, unfortunately, the world doesn't always work like that. We live in a world of gray. Coloradans need to be able to work to earn a living, to support themselves, to put food on the table, to earn their rent. And we want to give everyone the opportunity to do that in as safe a way as possible, recognizing the risks are greater than they were before, which is why it's still important that people over 65 stay at home except when absolutely necessary. The risks are greater, but we need to do this in a sustainable way that we can endure and get through as a people, as a state, for the months ahead. This is a phase-in. April 27th, that's today. People can buy curbside pickup at retailers that choose to be open for that. It's a relatively safe practice. It means that you can place your order, they can bring it out to your car, they can put it in. That has started today. If there's goods that you need, call your local store. They may have decided to open later. They may not be open yet. In some jurisdictions, they have not begun today. But generally, curbside pickup has begun, and real estate showings have also begun. May 1st is a very important day. That's the day that there's retail stores. So many retail stores, some of their employees are able to pay today, which is great. People need to earn a living. They're also preparing. They're doing curbside pickup if they want to, but they're also preparing to open May 1st. And that means doing the kinds of things that hopefully your grocery store has already done, right? It may mean applying decals in the line, making sure they have a system to not have too many people in the store at once, putting disinfectant out for people to use, all of those kinds of measures that those essential retailers have put in place that we sure hope they have, and we're working with them to have done, and they're accountable for doing. So too, all the retailers that want to open May 1st will be doing over the next few days. And when they open, their employees will all be wearing masks. And we really ask you as not just for your own protection, but also just as a common courtesy, make sure to wear a mask when you are shopping in those stores as well. You are, and many of them might even have mask-only policies, but even if they don't, please wear masks when you're in public. All the employees of the store will, and the least that we can do for them is also wear masks. And personal services, that means that you can get that haircut, and those salons are opening with additional protections that are in place to make sure that we put the safety of the workers and the customers first. And then May 4th is when it can be back to work for many people who work in offices. And they'll still have to be at reduced capacity for social distancing, but offices can resume work with up to half the people being on the premise at the same time and in a safe way. It's also important to note that during this period, our seniors, our vulnerable populations, need to continue to stay home, except when absolutely necessary. This virus is far deadlier for people who are immunosuppressed, who have respiratory issues, who are over age 65. And it's still out there in our communities, and we want to do everything we can to make sure that people stay at home except when they absolutely need to. And I hope that others that are not in that category rise to the occasion of helping our elderly friends and neighbors. Ask your 73-year-old neighbor, can I bring groceries to your door so you don't need to go out? Or can I teach you how to use Instacart or some delivery service so that you don't need to go out? No gatherings of more than 10 people. Critical businesses, all the ones that have been open, continue to stay open. Retail businesses open first for curbside delivery today. May 1st, they can open the doors to the public with some of the similar protections to those critical retail businesses that have been open all along. Restaurants and bars remain closed, except for takeout and delivery. We're working towards the guidelines of what it would look like when they reopen, but we don't yet have a date for that because it really just depends on the data that will emerge in the next few weeks. We all want that to be as soon as possible, but we also know for both the customers and diners and those who work in those establishments, it has to be in a reasonably safe way, and we're committed to doing that as safe as we can. It's also important that Coloradans wear cloth face coverings when you're in public. What does that mean? People always ask. When you're doing yard work in your own yard, it doesn't mean you need to wear a mask, but if you're going to a municipal park where there's others, certainly if you're going shopping, very important to wear a cloth face covering. It should cover your nose and your mouth, not get in the way of your breathing. You can make one out of an old t-shirt. You can find out more at coloradomaskproject.com. What it also means during this phase is that nightclubs, gyms, spas also need to remain closed. One more thing on masks, by the way. I know that for some communities in Colorado, especially communities of color, wearing a face mask is difficult and sometimes can create anxiety. But we all need to wear face coverings now to protect our health and protect our loved ones. And we need to show complete social acceptance of anybody who's making the right choice to wear that mask, because they're doing it for your sake, for their sake, and for the sake of our community. Non-emergency medical and dental procedures have also beginning with precautions to ensure that the hospitals and dental clinics have enough personal protection equipment, have enough masks to do that. But it was hard to ask Coloradans not to do these things for 32 days. These are procedures that people need. I've heard of people that say they have cavities, they need fillings, they have crowns that need to be replaced, they need that knee replacement surgery. Those have begun again. It's a hospital-by-hospital basis. Some that have more COVID patients are waiting a little bit longer before they can take them on. Others are scheduling them now. And they all need to make sure they have enough protection equipment. And personal services, an important part of our way of life, of our society, a livelihood, something that puts food on the table for many Colorado families, salons and spas, dog grooming, personal training. We'll also have very strict precautions about how they can reopen in a way that maximizes the safety of both the workers who are earning a living as well as customers. We already suspended normal in-person instruction at our preschool through 12th grade schools for the rest of this year, for the few more weeks that this school year has. Now, I've talked a number of calls with superintendents. Many school districts are also, and they're able to do this. You're using your buildings, meaning you can have one-on-one meetings there, providing small groups, special ed services. In some cases, there's vocational classes like the need equipment that can't be taught entirely online, like welding or shop. You can have groups of smaller than 10. Many school districts are doing that to finish out this semester. But the normal in-classroom instruction is suspended, and really they're working on the protocols for how we can do this more safely in the fall. And that means things like not having the same passing time for every student, right? Think about a way a normal school works with a normal schedule. Most students in high school, even in junior high, all out in the hallways at the same time. So they're working on sustainable ways to increase social distancing. In classroom instruction is not resuming for the next few weeks. They're doing online. working on those protocols for the fall, and they're able to use and encouraged to use buildings in an effective way. There's also many rural communities where the building is a site of internet connectivity for the 5 or 10% of families who might not have it at home. So some kids can go to the site, a couple per classroom that are certainly have more than enough spacing, are able to access the internet there. But the normal days of crowded classrooms and hallways is not resuming this year. We also are allowing some post-secondary instruction to resume, and that includes technical and vocational programs through the Colorado Department of Higher Education that cannot be done remotely. Most classes have been very successful in converting to online. Remember, many students attended college online in the first place, or junior college or vocational. They all went to online, but we also recognize that some of them need to access physical vocational programming, right? It could be metal work, or it could be welding, any of those things. So they'll be able to get back, consistent with the safety guidelines, groups smaller than 10, working with the Colorado Department of Higher Education, just as we finish up this semester. And another crucial component that we are really upping the bar on during this safer at home period is protecting those who live in nursing homes, senior care facilities. And I want to spend a moment on this because this is a big concern across all the states. It's been a priority of my administration since we started our efforts to fight COVID-19 day one. More than half of the deaths in our state are among residents of nursing home and senior care facilities. When this first started in Colorado, you might recall Washington State was a week or two ahead and having more cases. I called Governor Inslee every week for a few weeks, and I said, what do you wish you know this week that you knew last week? And that very first week he said, we needed to institute, we should have restricted visitation and checking on symptoms at our nursing homes. And that's why that was one of the very first things we did. We restricted visitation, we required symptom screenings at senior care facilities, and we'd be in a lot worse place today had we not taken that as our very first steps ahead of the shutdown order or anything else. Those were some of the very first steps we take. Now, it doesn't mean that we shouldn't be taking additional steps, and we are. We are now requiring a COVID-19 prevention and response plan that every senior care facility needs to submit to the Department of Health by May 1st. Every facility needs to have a plan to isolate people who have COVID-19 symptoms or positive tests without symptoms. We already have in place that all facility residents, employees need to wear a mask and other face coverings when in public, but we're trying to increase compliance with that to make sure that really truly happens in every facility in the state, and also making sure that they're wearing appropriate masks when they're at the facility. We've also prioritized the delivery of masks and gloves and gowns to nursing homes and other facilities through the Colorado National Guard, and we're conducting testing at those facilities of asymptomatic workers. Because remember, about half the people who contract COVID don't show symptoms, but are contagious. And you get just a few of those going into a senior care facility, it can result in mass deaths. And we've tested hundreds of people already, and there were 5 cases of people that were asymptomatic but positive that are no longer going to work in those senior facilities. Each one of those might have cost 5 lives. So directly saving lives by prioritizing testing, working with the Colorado National Guard, and continuing to work in collaboration with CSU and other partners. We're going to have an update on testing on Wednesday. We're going to talk about testing for about half an hour. A lot of exciting news. It'll include the nursing home work and other work. I know everybody wants to see what is the state plan for May, how are we going to make sure that we're reducing the spread through testing and tracing, one of the 4 things that we need to be able to complete and do in May to be successful. I also want to talk about local enforcement and flexibility, because we are a big, diverse state. That's not a bad thing. That's a good thing. You can't expect that Bent County with 0 cases is going to have exactly the same policy as Denver with several thousand, or the same as Rio Blanco. So local communities across our state have 3 options. They can either match the state guidelines. That's perfect, no problem there, simple. They can also, especially if they have hotspots or have larger areas, they can continue to have more restrictive rules in place. That's what several counties have done, where the stay-at-home order, their stores open 4 days or 7 days later than Denver, and their offices open 4 days later than other places. They're able to do that as well. And of course, local flexibility. These are areas that are able to, because of their great success in implementing public health and safety measures, can go further in loosening restrictions in the rest of the state. We know that many counties, are different across the state. This is a case count load. You can see that we have different trajectories in different parts of the state. We see bigger circles in areas like Denver and Jeffco and Arapahoe and El Paso and Weld. That means a lot more cases there. They probably should be less hesitant about requesting permission to go further and relaxing restrictions. But we also see other areas where the virus has very low case count, has no growth or no cases over a period of weeks, and some of them are seeking to be able to do more sooner. And there's certain local conditions that any part of the state will need to meet before we can allow for more flexibility. And these are consistent with the CDC guidelines, the President guidelines, our guidelines, all very similar. They have to show either a very low number of cases per day, 0 or 1, very low, counties that haven't had a case in a week or two, or cases declining for the past 14 days, one of those two, and they need to show that they have an early warning system to swiftly detect and address an increase in community spread so we can be on it quickly, right? Because this is a bit of a stealth virus. We want to make sure that you're not waiting until you have patients on vents before you identify the outbreak, because then it could have affected dozens or hundreds of people because of the lag factor. We want to make sure, and many communities across our state are putting this in place, the ability to get on it early so that they can take the steps they need to contain outbreaks, ideally at the site level, but failing that at the county level. And there's requirements the local governments need to do to have more flexibility. They need to have the local public health agency support their plan. The local hospitals need to verify that they can treat the caseload, that they're not a burden for the rest of the state. And the county commissioners, the elected officials there, need to vote to adopt the alternative plan that's in place to replace the safer at home executive order. To give you a couple examples, Eagle County has successfully received a waiver, and Mesa County should be approved either late today or early tomorrow, after both health departments submitted thoughtful suppression plans supported by the county commissioners and local hospitals. Disease prevalence is now low in these two areas. Both have early warning systems in place and know that they need to tighten up restrictions if disease transmission starts becoming widespread and a greater danger. And this is the importance of this process. By doing this, we can help protect health and safety while allowing for local flexibility in a big, diverse state like the state of Colorado. And we look forward to partnering with communities across our state in that regard. The bottom line is, our state is counting on us to be smart and to save lives and livelihoods. Counties and communities that disregard this order, that are not pursuing one of those three directions, either complying with the state order, going further, or exercising their local flexibility, are breaking the law of the state of Colorado. They're jeopardizing their emergency preparedness grants. They're unnecessarily putting lives at risk. And they're also doing the exact opposite of what they might espouse, which is they are actually increasing disruption to business and jobs by contributing to worse public health, greater spread of the deadly virus, and likely additional closures in their area because of additional viral outbreaks. Businesses as well, who are disregarding these safety regulations, will be issued a cease and desist order and can also have their licenses removed. And we know that the people of Colorado will tell us if there's a store that's not implementing social distancing, if people are lined up shoulder to shoulder in line, if they're not doing what they need to do to be safe, that store will not only be scaring off their customers, putting their employees at risk, yes, the state will also make sure they're not contributing to a public health outbreak that costs Colorado lives. We take this very seriously. We are moving from a phase of safe at home where there was no real enforcement of the stay-at-home order. People were not arrested or charged when they were out and about their neighborhood, to a phase where enforcement is absolutely critical. At the county level if needed, and certainly at the business level to make sure that businesses are complying with this public health guidance. There's always been public health guidance for businesses, to put this in perspective. They always have laws and orders that they need to do. They just have more rigorous safety rules that are very reasonable. The essential retailers have already been reaching them. They're not a great cost to retailers, but they have to make sure that they implement them successfully to be able to, in a safer way, open their doors to consumers. And that's why they have several days to do that. Those guidelines are all up on the website. We need to work together to protect Colorado. And we have been working together. Most of this weekend, I've been on stakeholder calls with hundreds and thousands of Coloradans about these different public health orders, over 750 people across different industries. We've had hundreds of public comments already on these orders, and I'm sure we're going to get many more hundreds on the days ahead. We also had webinars with over 2,000 representatives of local government, state and federal government, businesses, local health agencies, and countless numbers of individual conversations, cabinet-level working groups with folks in each area. And we want to hear from you. So please give feedback at coloradosaferat-home.com. You can view the public health order there. You can view the criteria for protecting your business and keeping it safe there. And you can also provide your comments. When we determine how we can safely reintroduce different activities, a lot of it hinges on the potential risk of spreading the virus and how we best through strong safety measures, can reduce that risk. And we know that the virus is spread in two ways. Aerosol clouds from your nose or mouth when you cough or sneeze, which is why masks are so important, and touching a contaminated surface and then touching your face, which is also why masks are so important, right? Because what a mask also does is it prevents you from touching your nose or mouth after you've touched a contaminated surface. And I'm going to give some of this information that we're providing to businesses at a high level, just so there might be some store owners watching this too, but most of you are potential customers, just so you know what your stores should be doing and what they need to be doing when they open their doors May 1st. For businesses to reopen, they need to have distancing in place, just like hopefully your grocery store has had. That might mean decals on the floor where people wait for the line, how many people can be in the store at the same time without crowding. Regular hand washing, sterilizing of surfaces, increased air ventilation, and the employees will all be wearing facial masks. And across the state, employers have time to learn these critical steps that they need to take. That's why some people have asked, well, why doesn't this happen today, April 27th, when the stay-at-home ended? Why isn't every business and store open? It's because they need the time to implement these measures before they open their doors to the public and their workers in a greater way. So retail stores May 1st, offices May 5th. That gives them several days to read through and implement these measures, which we take very, very seriously to protect people's health when they're shopping or when they're at work. There's also industry-specific best practices at coloradosaferat-home.com for retail, for offices, for elective medical and dental care, for child care, for education, for personal services, for real estate. The specifics are being provided for each one. And if you work in one of these, you can find out more at coloradosaferat-home.com. I'm just going to give you a 30,000-foot level review of some of the guidelines for retail. That's a sector that most of us interact with. Most of us shop for something at some point. Retail includes things like merchants and clothing and home goods, cell phone stores, thrift stores, fishing tackle, sporting goods, boutiques, all those things that we think about that provide a livelihood for so many Coloradans. Retailers who want to start doing curbside delivery and pickup have started today. Retailers that want to begin letting customers into their store start May 1st once they implement those best practices that are in those guidelines. Here's how employers are required to protect the workplace. First, they've initiated curbside delivery and pickup, minimizes touch without letting patrons in the store. That's still a great way to buy things after May 1st. If the stores are offering it, if they can bring it out, put it in your car, great way to buy things. Very safe, much safer. We want them to continue that curbside pickup and delivery where they can. Elevate and increase the frequency of cleaning practices in stores. Conduct daily temperature checks and monitor any symptoms for all employees. Immediately refer symptomatic employees to our Department of Health symptom tracker, which is available online. And posting signage for employees and customers on good hygiene and other sanitation practices. There's also some protections for employees in place. Employees need to wear face coverings, and if they're touching surfaces, gloves as well. Encouraging frequent breaks to wash hands and sanitize hands. And very important, require employees to stay home when they have any signs of sickness. Under a previous state order, we have up to 4 days for paid leave. That's enough time to get a COVID test if you are ill. If it's negative, you can go back to work. If it's positive, you go under quarantine and we'll do the tracing. But that's very important as well, that anybody who's sick not be allowed to work. That's a responsibility both of the employer and the employee. And as well, we want to protect customers. Customers as well should have 6-foot distancing measures in place, marked spaces in checkout lines. Customers should use masks. Hand sanitizer at entrances of stores should be provided. That can be on your way in and your way out. And we're encouraging all retailers to have special hours for vulnerable populations. And we encourage the vulnerable populations, if you absolutely have to go out, if you can't have a friend pick it up, if you can't have it delivered, please use those special hours. Now, we're not going to go through every industry today. You can view all the guidelines, and this is mostly for people that are small businesses in those industries, at coloradosaferathome.com. Check that out. There's a way for you to give your feedback. But this is the way that you'll be able to, in a safer way, begin earning a living May 1st, May 4th. I also want to talk about employee protections, and I want to answer two of the most common questions that we're getting. The first question is, what if my employer is requiring me to return to work, but I don't feel safe? Very clear answer to that. No vulnerable individual can be compelled by their employer to return to work if the work requires in-person work near others and puts that employee at risk. If the work can be done remotely, employers need to accommodate vulnerable individuals with remote work options. If an employer requires work from an employee that's entitled to paid leave due to illness or a quarantine order under the Colorado HELP rules, that would be unlawful, and that needs to be reported to coloradolaborlaw.gov. Second question we get asked a lot: my workplace wants me to come back, but with schools closed, I don't have childcare. What can I do? So, first of all, employers need to make accommodations to the greatest extent possible under law for workers who are experiencing a lack of childcare due to school closures. That can include things like remote work options or flexible scheduling. Federal law provides up to 12 weeks of paid sick leave at 2/3 the employer's regular rate of pay because of child care needs due to coronavirus-related closure of a school or child care establishment. And the CARES Act also provides unemployment benefits under pandemic unemployment assistance to those unable to work due to COVID-19. We're going to distribute additional information about your rights as employees. Many of you want to earn a living, but you also want to do it in as safe way as possible. And it's very important, as offices go back to 50% capacity, there's still a lot of room there for people who are in vulnerable populations or people who have young kids at home to continue to telecommute. And by the way, that 50% going back, that is a ceiling, not a floor. We encourage all businesses, if they're able to operate at 60, 70% telecommuting, keep that up. As many folks who are able to telecommute, the better. We're modeling that as a state. During the stay-at-home period, we've been between 70 and 80% of our state employees. And we do everything from run a lottery to clear roads to process tax returns, but we've been between 70 and 80% telecommuting. And the state, as an essential industry, has not had to do that. Now, with it going down to 50%, we're still going to be well above that. I'm expecting that during this period, we'll be closer to 60% of our state employees during much of May will still be able to telecommute and work from home. We want all businesses, to the extent you can, allow people to telecommute or have people work on different shifts so you have less people in the workplace at any given time. Finally, we have an ask of you, and that is your help in enforcing these standards. Local public health, local law enforcement simply don't have the capacity to monitor every business every day to make sure that they're conducting business in as safe way as possible to prevent the spread of the deadly pandemic. But you, the public, are our eyes and ears. You're not our noses and mouths, so those are covered, but you are our eyes and ears. Helping to ensure safety in every store and every business in Colorado is a responsibility we all share, along with staying home when we can, wearing masks when we're out, and practicing good hygiene, washing our hands regularly. If you see establishments that are not taking the proper precautions and are disobeying the public health order and violating the laws of the state of Colorado, putting you and others at risk, report them to the local public health agency and the Attorney General's office at COVID-19 at koag.gov. We all need to do our part to keep ourselves and one another as safe as possible during this safer at home period. Because at the end of the day, the people of our great state, you, is what gives me faith that we will be successful. We did a terrific job staying at home as a state of Colorado, despite all the difficulties of doing that. That's not blowing smoke. The numbers wouldn't be where they are today if it wasn't for your dedication and success. We would not have an R-naught value close to 1 if it wasn't for your commitment to making this work. We would not have been able to slow the growth rate and build hospital capacity, acquire more masks and gloves and testing if you hadn't done your part with our state and for our state. That's what gives me faith that you will be successful in this next phase. We no longer need a stay-at-home order across the whole state of Colorado, but that doesn't mean that each city or community is ready at the exact same time to lift that. So make sure you're following any local law or restriction in your area as well. We're not out of the woods yet. You need to make sure that you're still taking the steps that you can to protect yourself and others. And if folks don't practice personal responsibility, the rate of positive cases and hospitalizations and deaths could start to increase again, and then there could need to be additional restrictions that are placed on our activities and ability to earn a livelihood. Nobody wants that. That's why I know that we all have the same incentive, whether you think that these restrictions should go further or whether you think that they don't go far enough. We all need to do our best to be able to practice social distancing and wear masks when we're out, because none of us want to see more severe restrictions come back. So let's continue to work hard at preventing the spread of coronavirus. The more successful we are at the safer at home phase, the more you're following the law, the more lives we will save, and the sooner we can go back even further in getting back to something resemble normalcy, restaurants or bars and other activities. Know that as your governor, I'm doing my best to ensure that you have the legal ability to earn a living and the psychological fulfillment you need while protecting the public health of the people of Colorado. I have a few questions from the general public before we get to our reporter questions. I mentioned I would be adding that. These are just some of the Facebook tweets and posts, a small fraction of the number that have come in. Carol Hunt said, I think you are going to have to be more forceful about the need to wear masks. If you want people to wear one anytime they are in public, you need to state that. You need to wear a mask whenever you're in public. It is extremely important. I say that every time I have the opportunity. It is incredibly important to wear masks when you're in public. That doesn't mean in your backyard doing yard work, but it means when you're in your neighborhood park or when you're shopping. Jordan asked, as a small business owner that does personal training, I have zero directive as to what requirements I have to follow to reopen those services or prepare to reopen those services as of May 1st. Please give me some direction. That is available now at coloradosaferat-home.com. You can view that, and you have several days, if you choose to open your business May 1st, to make sure that you're meeting those safety requirements that are needed to do so. Harley asked, what's going to be the ruling on campgrounds in Colorado? Campsites are well over the social distancing apart that needs to be maintained. Going camping with the same people you're already quarantined with at home anyways. Are we going to allow them to open so we can use our reservations and the state parks can make the money so that they can pay wages and bills again? We are one of the handful of states that have been able to keep our entire state park system open during this entire COVID crisis, and I'm very proud of that. I'm proud of Dan Gibbs and Dan Prenslow and the team at Parks and Wildlife for being able to do that. We hope that sometime in the near future, those campgrounds will reopen, but there's really two factors that we're considering. One is, at this point, many communities across our state are not ready to receive tourists from other parts of the state and from other states that inevitably come with opening campgrounds. So specifically, many of the mountain communities of others have asked, and we should respect, given that they were many of the epicenter for viral outbreaks in our state, that they need a little bit more time until they're ready. So that's less about the campground itself than about the gas station and the convenience store in the town where they don't want to have the risk of reinfection from people from the Colorado Springs or Denver metro area. The second is the protocols around cleaning those campgrounds in between uses. But as soon as it's safer, we hope to be able to do that. Finally, from Beth. I've not yet heard back about this. Why are gatherings of 10 okay? This seems to go against all else on these orders. Why take the risk? You should not take the risk if you don't want to. Nobody should feel that you have to go out in a group of 10 now. That's simply permitted. The safest thing to do, you're safer at home. It's safer to be in the smaller group, the better. But yes, if you need to be in a group of up to 10, that is now legal in the state of Colorado. Doesn't mean you should run out and do it. If you're over 65 or of a pre-existing condition, you should stay at home except when absolutely necessary and not go into groups of any size. But for those who want to, you can return to groups of up to 10 for social purposes or for commercial purposes. With that, we'll open it up for questions. Thank you to the people of Colorado for making the safer at home phase possible.
Governor, look into your crystal ball for me, if you will. If you fast forward to the end of May and everybody follows what you've just laid out and the trends continue the way they have, what do you suspect you'll be saying to us at the end of May, and how might Colorado be different?
Well, we have guidance and work that we're beginning now that we hope can go live during May. That includes a way that restaurants can open, a way that campgrounds can open. I would hope that if we're meeting the success indicators and the people of Colorado are wearing masks in public, if they're following the social distancing requirements, we'll be able to talk about additional measures in June. But it'll all be based on data that we have, based on the early indicators, based on the caseload, based on the scaling up of the testing and tracing, and our success in keeping our most vulnerable safe during this period. Telephone question?
Governor, this is Vinny Del Giudice of Bloomberg News from Denver. Thank you for these regular briefings. Two items. Number one, as the economy opens up, is the supply of testing supplies from the federal government, swabs, et cetera, improved over the last week, or is there still a gap? And number two, can you fill us in on today's White House conference call? There are reports that the president asked governors to reverse course and actually reopen schools this year. Thank you, Governor.
So we are going to give a detailed presentation on testing because it's a really exciting, interesting topic. I spend a lot of my time on testing the last month and a half. We need half an hour, 45 minutes to do that. It doesn't justify it to give you a 2-second answer. I will just reiterate some of the news we announced from last week. We have received over 100,000 tests from South Korea that we purchased from Solgent, additional swabs. We've already begun testing of asymptomatic individuals that work in nursing home facilities, and we're going to have a detailed update on that on Wednesday. We have regular calls with the president, with the vice president, with head of the CDC, the FDA. I'm on the phone with federal officials almost every day in some way, shape, or form. Today there was a call with the president and others and 30-some governors. The president did mention schools reopening. I actually spoke to that in my remarks to him. I indicated that in Colorado there's just not enough time before the school year ends to open schools. We're in early, most of our districts on a pretty early schedule. They go out late May. So by the time the distancing requirements were implemented in our schools and passing times and schedules were changed, it would essentially be the end of the year. But I did update them that I've encouraged, and many districts are, using their school buildings. I've said this in every superintendent call. I say, don't let your school buildings go to waste just because you can't have regular in-building classes. If you're able to have one-on-one meetings, if you're able to grant limited access to equipment that people don't have at home that they can only get in school, if you have kids that live in rural areas with no internet access that can come in and, one per room, use the computer and internet, those are all good uses of schools. Many of them are doing that. And I think the president was thrilled that we are being able to use our school buildings and capacity in a safe way here in Colorado. And then we didn't get into higher ed, but the institutions of higher education are beginning some technical classes as well. Next question from the room.
Governor, you have said that enforcement is critical, but yet there are some counties that have said that they're not going to abide by the safer at home policies that you've set. What specifically will you do when businesses in places like Weld County refuse to abide by safer at home policies?
Well, any business that illegally opens is violating the law. And, hair and nail salons are able to open May 1st. If there's some that are trying to open prior to that, they risk losing their license to operate, which is through the Department of Regulatory Affairs, DORA. Same with liquor serving establishments and bars. So these are, even in good times with no COVID, there are many requirements around that at the state level, because these are, they have sanitation requirements and other requirements. Now, there's additional requirements during this period. None of them are inconsistent with doing business. They all have been stakeholdered with people who work in those industries, and they're all very reasonable best practices to do. And people need a few days to implement them. And then they can open in a safer way, a way that's safer for their employees as well as safer for their customers.
That they're not going to tell their businesses what to do. Will you go in, will the state step on the commissioner's authority in that particular area?
Well, one of the three options is local flexibility. Mesa and Eagle County have applied for that. They've met the criteria. I expect other counties will. Weld County is not yet there. They are a viral hotspot. They have not yet had 14 days of decreasing virus count in Weld County. When they do get there, and I hope they get there, and we want to work with them to get there, we look forward to working with the commissioners to safely be able to reopen the economy at a greater rate because of their success in battling the deadly virus. Telephone, please.
Thank you, Governor. Charles Asher with the Grand Action Daily Sentinel. So I noticed in your guidelines that you have a travel and transportation section telling people not to leave more than 10 miles away from their home, not to go into the mountains, not to come to the western slope. Though I'm sure you're aware that there are areas that are concerned about people from Denver or out of state coming here. You know what's going on in Gunnison right now. I'm wondering that with your Western States Pact, are the other states telling their people not to travel to other states as well? And why aren't our adjoining states also in that pact?
So I certainly hope that that states are telling folks not to come to Colorado. We're not ready yet. Our mountain communities, communities in western Colorado and eastern Colorado, don't want people from the Denver metro area, Colorado Springs metro area, bringing the infection to areas where they might have eliminated it. And that's what we're hearing across the state. Our communities will be ready when they're ready, and our mountains and rivers will be here long after any of us, and they're going to be in great shape to visit in the near future. I also encourage residents of other states to not yet recreate in our beautiful state of Colorado. We want to increase opportunities for local recreation during this period. We've kept our state parks open. We encourage local visitation and support for outdoor living in our great, beautiful outdoors, which is why so many people live in beautiful western Colorado. But it's not yet ready to open for people that are visiting from other states. As soon as those communities are ready, I look forward to joining them and welcoming visitors from across Colorado and from our states. I talk to our neighboring states on a regular basis, governors of Wyoming, of Kansas, of Utah on a regular basis. We have good working relationships with those governors. Many of our health and safety regulations are similar to those areas, and we look forward to, however formally they want to participate with us in working in a joint way around our mutual needs.
How important it is for folks to be wearing a mask while they're out in public. What is your message to essential employees who still are not wearing masks in stores?
Well, they are required to. The question was, what is our message to essential employees who are still wearing masks in stores? First of all, you're violating the laws of the state of Colorado. If you are working in essential retail, which is already open, or any retail that opens May 1st, you need to wear a mask. And if you're not wearing a mask, not only are you violating the law, you're putting yourself and your customers and your business at great risk. And you will scare customers away from your store, and you increase the likelihood of a site-based infection, as we've actually seen at, for instance, a Walmart facility in Aurora. Next question from the phone. Phone?
This is Phyllis Wilson, freelancing for the Colorado Independent. So we've seen the effects of social distancing can take weeks to show up in the data, and I'm wondering, are there more responsive metrics you will be observing to judge how effective the safer at home phase is at ensuring proper distancing? And will you be able to lock down again in time before a second spike happens?
Yeah, so we have much greater visibility into this pandemic here in Colorado. That includes the expanding testing we'll be talking about Wednesday, symptom monitoring that goes right into the symptom tracking system, which gives us real-time visibility through Department of Public Health and our Emergency Operations Center. And then any counties that are exercising that local flexibility need to demonstrate that they have that early warning system in place so that we can have site-based response, ideally, to an outbreak, if needed, community-based response, and hopefully never need to have that statewide response in terms of a stay-at-home type order statewide. You want to react at the site level first. If that fails and you don't get the warnings and are not able to do it early enough, you act at the community level.
I love this 10-mile restriction on people moving. You're talking about eventually state parks being open, but your order is suggesting people shouldn't do that. How are you going to enforce that? How are you going to keep people within 10 miles? Certainly people are going to ice and things like that.
Yeah, so, most Coloradans, I dare say every Coloradan has numerous municipal parks or county open space within 10 miles of their home. Try to find somebody that doesn't live within 10 miles of some kind of municipal park or open space. I don't think you can. It doesn't mean you can go anywhere in the state. Many of our communities that rely on tourism have had high viral count loads because of that tourism and just need more time where they need to get on their feet, where those opportunities are there for locals to visit those local parks, and they will be open again. And we hope it's sooner rather than later, but we really important that we respect the wishes of those communities. And there's two things that we don't want to happen, right? We don't want you to go out to an area where you might get the virus because others are congregating there from across the state and other states. And we also don't want people who unwittingly are bringing the virus back to communities that have made great progress at great cost at fighting the spread of the virus in their communities. So enjoy those recreation opportunities that are relatively close to home. It might not be your top choice or two. You might have to say, you know what, I'm going to go to my third favorite park instead of the one I really wanted to go to because that's a 2-hour drive. And you know what, you made the sacrifice of staying at home for 32 days. I think you can make the sacrifice of going to your second or third favorite park for another month. And that's all we're asking during this phase and during the month of May. Telephone, please. Okay, in the room? Sí.
Ahora para que no pierdan, pero ¿cuál es su mensaje para la comunidad hispana en general?
Es importante en esta fase que todos entiendan que todo no es seguro permanente. Es un poco más seguro del pasado y más personas van a tener oportunidades para trabajar y ganar dinero. Pero es muy importante, especialmente para los viejos, para continuar quedándose en su casa y los demás que solo salgan para diligencias específicas. Esta nueva etapa va a funcionar si todos hacemos nuestra parte. Más personas deben trabajar y ganar dinero y es un poco más seguro del pasado, pero también es muy importante tener cuidado en todas sus acciones. Gracias. Telephone question, please.
Governor John Frank here from the Colorado Sun. One of the options on the table to deal with the budget cuts related to the coronavirus is reducing how much money goes to full-day kindergarten. Do you think that option should be on the table? And what other options would you present forward if you don't want that one to happen?
Well, we will be having an updated budget forecast in about 2 weeks, John. And a lot of the specific information about the cuts will be based on that budget forecast. I think you're asking about, our P-12 education system. I don't think we're yet sure how the COVID crisis will affect the total count in education. It's certainly possible that some families will choose to homeschool next year that didn't this year. Because of their worries about the safe environment in the schools. But we're going to do everything that we can to make sure that classes are ready to resume at school facilities in August, and that they do it in a safe way. And that might mean different scheduling, it might mean different entry and exit periods, and it might mean additional spacing in classrooms. But of course, we're unsure how parents will decide to participate or engage with our public schools at that point. Yeah.
They're worried about their health, about their child care as they return to work. You issued an executive order that addresses some of that, but that's a really hard decision to make. Do I confront my employer? What kind of resources and enforcement will you put into ensuring that workers can feel safe either in returning to the workplace or in refusing to return?
Yeah, it's illegal for your employer to force you back to work. If you're a member of a vulnerable population, they're putting you at risk for doing so. But Coloradans, self-employed Coloradans, many others are making this decision. They're saying, do I want to go back to work as a hairstylist or not? And if many of them, and if you are among this, if you can afford not to, many of them are saying, I'm not going back. I'm able to afford to stay out till May 15th or till June 1st and avoid taking risks. Others have to make the decision that with the safety precautions in place, I need to earn a living. And just as customers are able to make that decision, the workers are able to make that decision too. And those who have the ability or able to telecommute are likely continuing to do that. And those who need to go back to work and earn a living are trying to do that in as safe a way as possible during this period.
Workers will be able to make that decision without endangering their livelihood or their unemployment benefits.
Yeah, we have the systems in place both through the CARES Act as well as under our executive order to make sure that those who are unable to return to work because they need to continue to stay at home receive the compensation that they need during this period and are given priority for being able to work from home. If up to 50% are returning to the workplace, for the 50% that are continuing to work from home, employers need to prioritize those that are over 65 or have pre-existing conditions in the half of people that are not being required to go in every day. Telephone question?
This is Ed Seelover with the Denver Business Journal. I know you talked a lot about restaurants and how you're looking at when to reopen them. Can you talk about the time frame for reopening some of the businesses that the order specifically says can't reopen now? And I'm thinking about things like gyms or specifically like casinos, which I know are dragged down by what's happening in Clear Creek County right now.
Yeah, so the difficulty with some of these businesses like bars and nightclubs and casinos is they're inherently social. And there's no state in the country that has figured that out. We hope to be among the leaders in figuring out how to do that in a safer way. It's not during May. It's not during the safer at home period. We've been clear. We look forward to working with public health officials as well as those businesses to see how they can be done in a way that doesn't jeopardize the public health or lead to additional spread of the virus and is reasonably safe for both employees and customers at those establishments. Final question from the room, Marianne?
Yes, Governor, during the legislative session, the legislature passed a bill increasing pay for National Guard. And I know that the federal government is paying for our National Guard, but have you figured out a way to increase the pay for those lowest paid National Guard members who are only making about $20 a day to leave their families, to leave their jobs? The bill the legislature passed doesn't go into effect until much later this year.
Yeah, and I'm very thrilled that that bill made it through. It's very important. You're right, we're at a time period where I want to thank the men and women of the Colorado National Guard for doing great work. These are folks who have other jobs. They left those jobs. Their employers keep them there, of course, for them when they return. But in the meantime, they are really putting themselves at risk and serving the people of Colorado. State guards across the country, the Colorado National Guard has my profound gratitude. I look forward to continuing to work on ways to better reward members of our Colorado National Guard for their hard work. Thank you all for joining us. We'll look forward to seeing you again soon.